My name is Amr Azim. I'm a reproductive endocrinologist at New York City IVF, and I want to talk to you today about low response to ovarian stimulation. Prior to in vitro fertilization, many eggs has to be produced. More eggs has to be produced than in natural cycle, which is usually one. And the reason is not all the eggs that are retrieved are mature, and not all the mature eggs fertilize, and not all the embryos continue to grow in the lab, and not all the embryos that grow in the lab are chromosomally normal. Because of inefficiencies at each step and the inherent loss of embryos as the time goes by in culture, optimizing the number of eggs obtained before retrieval is very important and increases the efficiency of the process. Some women respond to fertility medications suboptimally, meaning instead of producing 7 or 8 mature eggs, they will make 2 or 3 mature eggs, for example. And this is known to be a factor that reduces the chance with in vitro fertilization, chance of pregnancy with in vitro fertilization. And a lot of effort is done in the initial workup and during stimulation to predicting low response to ovarian stimulation and modifying the stimulation protocol or the methods used to optimize the outcome in women with low response. Low response is predicted on 2 things. Number one, ovarian reserve testing that would indicate low number of eggs in the ovary, and number 2, history of lower response to stimulation in a prior cycle, or history suggestive of other risk factors, example of that being smoking and ovarian surgery and exposure to chemotherapy, among other factors. If low response is predicted, effort should be exerted to improving the response in this or subsequent cycles. And this is somewhat accomplished by modifying the stimulation protocol in women with low response so that an optimal number of eggs is obtained. Some of the tactics used or strategies used to improve response in low responders is, number one, increasing the dose of fertility medications. However, beyond a dose of about 300 to 450 units per day total, there is no evidence that any further increase would improve the number of eggs produced, and it might also be harmful. Another tactic is to avoid long suppression of the ovary using regular dose Lupron or low dose Lupron for a long period of time, or prolonged use of oral contraceptive pills. Another tactic would be to use an oral medication like Clomid or Letrozole prior to starting fertility medication, or using low dose of Lupron to flare the master gland and improve the response. Other proposed interventions could be the utilization of androgens, the male hormones, in the few days prior to ovarian stimulation. Testosterone can be used as gel or as patches for about a week or 10 days before starting stimulation. And some have also proposed the addition of growth hormone with varying results. One tenet in the treatment of predicted low response to emphasize is that no woman should be denied treatment based on a simple lab test. The ovarian reserve tests have many fallacies, and they don't predict pregnancy very well. And because of that, every woman, even with low ovarian reserve, deserve the chance to be given medication and should not be denied treatment. Should be given medication at least once and observe the response, because response is not entirely predictable without actually being exposed to medications first. Thank you.